Welcome to our podcast, The Better You Are, The Better You Are. Whether it is physically, mentally, or spiritually, when you know better, you can do better. And when you do better, you'll be better. On this podcast, we share knowledge, expertise, opinions, and experiences. All things that can help you to change the game. By the time we're done, it's hard for you not to be encouraged. So join us. The better you are, the better you are.
Thank you so much, Cassius. So yes, everyone, hi, my name is Deja Bailey. I'm the outreach coordinator at Health Visions Midwest in Lake County, Indiana. Today we are joined by Dr. Dunju Poitras and Dr. Matori, and we thank you so much for being here. We are so blessed to have this conversation today in present day where things are being put on mute, taken away. So we are blessed to have this conversation during National Black Mothers Maternal Health Week, especially. So thank you so much. And kind of just going based off of that, what are your thoughts on Black maternal health? And I just kind of want to open up with the opening question of how does racial bias in the healthcare system impact Black maternal health outcomes? I know that's kind of a broad and heavy question, but how to kind of preface this conversation?
Certainly, if you look at health outcomes for mothers, that there is a great disparity, that there's worse outcomes for Black mothers than there are for white mothers. And I use Black mothers because there's something about the color of the skin, whether you're in Germany, whether you're here in the United States, whether you're in foreign countries, the Black maternal mortality rate is always worse than the white. It's significantly worse here than in most other countries, and that has to do with structural racism and the biases that are afforded to Black people.
Absolutely.
And of course, Dr. Dunju Poitras is speaking to the maternal side. She's maternal fetal medicine. I'm a neonatologist working with newborns. Anything that happens to mom when she's pregnant can impact the baby, the fetus, and ultimately then that newborn. And so issues that mom, and I know we're going to talk about lots of those issues and the factors that, and the risk factors that result in maternal morbidity, mortality, will then impact oftentimes the fetus and the infant too. So it works together.
Absolutely. Absolutely. So based on the CDC and National Institutes of Health, they state that Black mothers are 3 to 4 times more likely to have childbearing implications or health determinants that are based because of their being Black. So how would you kind of...
If you look at anything, if you look at the rates of people dying from COVID, if you looked at health cancers and other things, Black people always do worse than white people. And it's always somewhere between 2 and 4 times worse. And that has to do with a lot of factors, but there's something inherent to, and again, it's across the world. It's not just here in the United States. So there's something inherent to the color of the skin. And there's nothing biologically different about a Black person versus a white person. But so you have to look at those structural things and social things that impose those discordances on Black women in the case of maternal health. Did that answer your question?
It did.
Aisha, we can hear you online. The online is perfectly fine, but just a little bit more projection so that the back end in person here.
Okay.
Good, thank you.
Appreciate that. Thank you. So how would you say, what kind of trainings could healthcare professionals go through in order to combat like the implicit biases? What kind of trainings did you guys all go through in order to become a medical professional?
I will say that so I give lectures on implicit bias in healthcare.
Yes.
And we talk about implicit bias training and cultural sensitivity training. If we just read the Bible and said we should treat people the way we want to be treated, I think that's a good lesson. We have things where I'm sure Dr. Matori and I could say, they said, what training did you go through? We went through life to understand what it means to be a Black woman in this society and a Black woman in, what traditionally it's been a white male dominated field, but
Right.
there are things that we all go through in life. There's sensitivities we need to have to whatever it might be. Riding a bus. How many people in medical school actually had to ride a bus anywhere compared to those people who do? So there's things we need to be sensitive to regardless of the color of our skin. But we do have implicit bias training. And I give these lectures and I say, it should be like the 2-minute drill in football. You can't do it just once and say, I got that. When it comes down to the 2 minutes left and I want to win this game, we don't say, yeah, remember that drill we did a year ago? Just do that. We got to practice it and do it every chance we get if we want to be well at it. And so oftentimes we fall short in those efforts to be more culturally sensitive.
Absolutely.
Yeah. And I'll be honest, in terms of my training and medical school residency and the like, I did not have any specific courses that spoke to implicit biases and, discrimination. I will just have to say, I trained a lot of years ago. And so that has been identified now. The DEI initiatives have been identified. They are important. And more work is being done, lectures like Dr. Dungy Poitras provides and others that help increase the awareness. Because if we don't talk about it, then it becomes something that, it's kind of whispered and, nobody's worried and we'll ignore that. And then it's not addressed as an issue, which we all know is an issue. It is a concern. And we need to, confront it and have those conversations with our colleagues, trainees, when I work with the residents and medical students, family, our church, wherever we can get the message out, to think about what it feels like to be discriminated against, what it feels like to be ignored, what it feels like to recognize that the people on that side of the room get some advantages that the people on the other side of the room don't get just because of the color of their skin. And so as Dr. Dungy Poitras indicates, we can tell you stories about situations. I've been told that, I kind of have a target on my back just because I am a Black female who is, involved in some leadership and some programming, but I'm Black. And so that doesn't necessarily work in my favor, but I love it. I am Black and I engage, I take it on,
Absolutely.
And my hope is that I can then spread that word to the generations that are coming up after me and the children. So once again, pediatrician, neonatologist, whatever I can do, whatever we can do to help our children, prepare better and move forward. I don't want to take over the whole conversation, but I really feel passionate about the fact that this is important work that we have to do for our children, for our people.
Absolutely. So what would you say for expecting mothers or birthing individuals that are having fear or apprehension about coming to seek care, medical care, and they don't want to go because they're afraid, they see everything that's going on, the DE initiatives being stripped away, DEI initiatives being stripped away. What would you tell them to make them want to come and seek care that they need?
Well, that it's important and that there are things that you don't let other people's opinions or other people's biases or other people's poor treatment hinder you. Do not cut off your nose to spite your face. If you need medical care. To give you an example, once I had a friend whose mom had a breast mass, went to her doctor. He said, you need a mammogram. And so she called to schedule the mammogram. The person was rude to the phone on her. She hung up the phone and said, I don't have to deal with that. And then she realized, oh, wait a minute. I'm only hurting myself. I do need this mammogram. She called back and she got an appointment. Turned out she had breast cancer. It was treated and she had much better survival rate than if she'd ignored that and said, because they don't treat me well, I'm not going to go there. Now we're on our side, trying to make efforts where we can help train people to treat people better. But even if they're not, get the care that you need. And I encourage people to find a doctor that you like and that you respect and that you have a relationship with before you get sick. So don't just wait till you're sick to go to a doctor. Don't wait till you're pregnant to go find an OB-GYN doctor.
Right.
Find somebody you can build a relationship with and have a good rapport with before it becomes critical in those situations. And you can do better in that regard. But don't, I've been places, we've been places where, they act a little, rude to you. And it may not just be people who are not the same color as you,
Right.
but don't cut off your nose to spite your face if you need the care and early access. And I will add that, when you look at, we always talk about early access to care.
Mm-hmm.
And we know that women who access prenatal care earlier have better outcomes than those who have late access to care. But then I always tell people, why do you think they're not accessing care? Do Black women who historically come into care later, is it because they don't have access to it? There's nothing in their community. They don't like the way they're treated. Maybe they're marginalized. And when you look at some historical things, like back in 2017, NPR and Robert Wood Johnson did a study, and they found out that 31% of Black women felt like they were discriminated against in the healthcare field. And 21% said they avoided healthcare because of it. Well, there's a reason for that. And for us on the medical side to say, well, these Black women just need to get in here earlier and get some care, or to understand why they're not accessing care. It's not because they don't care about their babies and they don't care about their health necessarily. It's usually things that are on the medical side, but we've got to work on both sides to confront those issues.
Absolutely.
How important would you say early screening for conditions like hypertension or diabetes or any of these things play a factor into?
If you don't know, you can't feel like you have high blood pressure. You can't feel like you have diabetes unless it's really bad. And so you need to have your blood pressure checked and have your blood sugar checked. And the earlier we get people into prenatal care, if we want to start low dose aspirin, for example, to reduce your risk of developing preeclampsia later in life, we want to do that between 12 and 16 weeks of pregnancy to start it optimally to get the best outcomes. So if you're not even coming in till 24 weeks or something later, then we haven't captured the best opportunity to reduce the risk. And Dr. Mattori can tell you the difference. What low dose aspirin does is push out when preeclampsia happens. So if it happens at 38 weeks, she can tell you the difference between a baby that needs to be born at 31 weeks because of preeclampsia versus 38 weeks or something with that. So it impacts the infant's outcome as well.
Most definitely, because when we look at infant mortality, there's a list of associated factors, risk factors to be concerned about. Top of the list is birth defects, congenital anomalies. Number 2, prematurity, low birth weight. And so what's being described is if that baby is born at 31 weeks, those are the preemies, those are the babies who go to the newborn intensive care unit. They sometimes don't breathe well. They have a myriad of problems, and they end up being in the hospital for quite a while. And I'll tell you, when babies come into the NICU at 31 weeks, we'll just use that number, and parents say, well, when will my baby be discharged? We end up telling them, think about your due date, because what we aim for is to ideally get the babies discharged by the time they would have been due. So once again, looking at full term versus prematurity just makes, such a difference. And sometimes, I know Dr. Dungy-Poitras will say this, sometimes moms have to be delivered early. Their health is being compromised. The baby needs to be delivered. And so we can't always avoid all prematurity, but oftentimes we can avoid a fair amount of it if people will come in and get the screenings and the testings, the medications, the monitoring that they need early on. And then it may seem like, and I'm sure you hear this, an inconvenience when they're told you're going to have to stay in the hospital, because we need to monitor. And Dr. Dungy-Poitras, that's her area. But the point is, we want babies that are closer to term than premature babies.
And I will also say, so maybe it's not just hypertension or diabetes that we're trying to manage early on and help reduce the risk of the complications of pregnancy, which also will help reduce the risk of your long-term effects 2 decades after you deliver. But maybe it's HIV, maybe it's syphilis, maybe it's an infection that can affect your baby that can be relatively easily treated and reduce the risk both for the maternal health as well as the long-term health of the baby, that we can prayerfully prevent a baby being born with congenital syphilis or HIV.
And so when we think about that and we realize the barriers that come with, how do we help a woman, to ensure that she's getting the adequate, care and pre-screenings that she needs? Is it advocacy? Is it relationship with the practitioner?
So yeah. Yes.
All the above.
Yes, okay.
It's advocacy. It's voting. It's way even before you get to the fact that, male or female, I want the best healthcare I can get. I want the best representation that I can get. I want the best resources and opportunities that I can have. So even just voting to have people who are representing you and in your best interest and trying to do the best for you is important. But also, the better you are, the better you are. So the better you start out before you get pregnant, the better you'll be during pregnancy, and the better you will be after pregnancy. And that's all your healthcare: high blood pressure, diabetes, lupus, any condition that you might have. The better you start out with before you get pregnant, the less risk for maternal compromise, congenital birth defects, and infant complications that we have with those conditions.
And something that we haven't spoken to yet is support. So most definitely we want moms to come for their care. We want parents to bring their children in, to the pediatrician's office. But the support oftentimes at home, in the church, in the community can make such a difference. So for that mom who's hesitant because of a negative experience she had on the phone call, she called in to make an appointment and someone was rude, to then hang up and then talk to either her good friend, her mom, her cousin, someone at church, just someone that they know who says, yeah, but you need to go. And to have that support from someone that they trust. And again, this could be a family member, it could be a friend somewhere else. It's important because that might be the voice they need to hear that says, okay, what's important is that I take care of myself, just as you gave the example, versus being offended by the fact that someone was rude to me over the phone. So I think the support that we can provide, I think conversations like this are so important because we spread the word. And that's going to be, to me, the bottom line in all of this. And if you have had a good experience with a physician and you talk to your friend says, well, I don't ever want to go to a doctor again. And you can attest to the fact that, well, my doctor, that I had at XYZ clinic or office, whatever, was really good. I liked her. I liked him. Maybe you then can convince that person to give it another try and to go in.
I will also say, sometimes it's not even the doctor. You can't even get to the doctor because you got that person at the front desk who's stressed, who's, told they need to do all these things. A lot of times it's not about you. It's just about the stress that they're having, but they're rude and you're offended by them. You don't even get past the clerk to get to the back door to meet the doctor, who might be totally lovely and very attentive and caring, but you're offended by the person who is answering the phone or checks you in, or the nurse who is overworked and taking your blood pressure and asks you, did you take your medicine today? And no, I didn't, because I was rushing because I had to drop this child off at daycare and I had to get the bus or whatever, or even, get there in time and I forgot to take my medicine. Now my blood pressure's up. And they sort of look at you funny and you're like, I don't like coming here. I'm not coming back. Try not to take that personally. I always say love is not easily offended. We just try to keep on. Don't be offended. Keep on going. Show them some love back and appreciation, and raise above it.
Now, Dr. Dungy-Poitras, you spoke to before how microaggressions appear. I think you stated in one of your previous calls or presentations that there's a professional doctor that in Georgia that put on their practice about the bonnet. No bonnets.
Yeah.
I refuse practice if you are wearing a bonnet. Can you speak to how that can kind of deter people? And
So in Columbus, Georgia, there was a sign on the waiting room window that says no bonnets, no service, or something to that effect. Well, who wears bonnets? I wear a bonnet. I wear a bonnet when I sleep. I don't wear it out. I don't like my daughters wearing a bonnet out, but some people do. And I don't refuse you service for that. And if that predisposes to a certain population of patients, because if you're knowledgeable about African American hair, that it's pulled out by cotton in pillowcases. And so if you want to protect your hair and help it grow, you wear a bonnet at night. The same thing with another example I had was a person with braids in their hair who would pat their head, who the nurses determined was psychologically
And we know that's a normal thing.
got us.
Yeah.
So because this woman, there's something wrong with her because she's patting her head. And I'm like, are you
Ridiculous?
Yeah. So there are things, and the more we can educate people on that, and just try to overcome that. So if it means I have to take my bonnet off to get the care that I need, because that's the only clinic around, then I'll take my bonnet off. But if I can do something to say, hey, why are you doing that? I don't like your hair color. I don't like that you don't wear your hair straight like I do. So I don't want, people who don't wear their hair straight or who wear, tattoos, or it could be anything. If we just try to treat people the way we want to be treated, maybe we could get past all that.
Absolutely. So we know it truly takes a village, right?
Amen.
So how would you say, we spoke to about having practitioners on staff that, you work in collaboration with. So what are your thoughts on doula care? What is your experience with doulas?
Doula is great. Doula is great. I will say that. Anybody who can advocate for you. I've served as somebody who advocates for somebody in labor, somebody who understands it more than you do, understands the processes, and to have a doula is awesome. I will tell you, I had, though, a bad experience with a doula who in trying to advocate for the patient, I had an example of a patient who left the hospital against medical advice, had risk factor that her baby could die, and was coming to clinic. And so people, in trying to not offend her appropriately, I guess, weren't giving her the best treatment. And so when I see patients, I want to know what they understand about it. So when I asked her, what do you understand about what we recommend and why? Her attitude was, well, you should know it's in the chart. I said, I want to know what you understand.
Right.
I will tell you, at the time I had laryngitis. So I sounded like this, and it sounded rough and harsh. And so, so then the mother stood up and said, I said, well, and she clearly didn't want to talk to me. I said, well, do you understand your baby could die? Because I need to know that. And the mother stood up. Well, you're being rude. You're being rude. You're talking about babies dying. And then the doula came in and said, you need to leave. The doula hadn't even really heard the conversation. She just heard the mom. But I said, I'm not being rude. It just sounds rude because I'm talking like this. And so then, so I'm like, okay, I left, and I went to see if somebody else would see the patient. Now, I will tell you, the other person who the patient had been seeing, they decided they'd just let her dictate her care, which is totally appropriate. But I need to understand that you understand that your baby could die. And this is why we recommend this treatment. And so, and I don't mince words, because if I say, well, your baby might have something really bad happen to it, but you didn't understand it could die. And then you say later, well, you didn't tell me the baby could die. And so then, in all that, the patient decided to come back into the hospital, maybe because she heard the word or somebody said it to her directly. And I will tell you, I was given a lecture maybe 4 months later, that doula came up to me and apologized. She said, I didn't understand what was going on and what you're saying. I understand better now. So it's important that you work together with a doula or whoever you're working with, to be listened, to be heard, to have it wasn't, while everybody was trying to protect this patient, it wasn't necessarily in her best interest to say, well, do whatever you want to do and don't listen to the consequences. So I have high respect for doulas, and doulas are awesome in interacting with people, just like a nurse practitioner can be, or a mom who understands things, or somebody. You need somebody there, because when you're in labor or in pregnancy, you don't always hear everything. You don't always, pay attention to everything. So you need somebody to help advocate for you.
Absolutely.
Thank you for listening in today. Weren't you inspired, encouraged, and uplifted? We hope so, because we're praying the best for you. Join us again next time for more betterment, because the better you are, the better you are.